Hey guys, thanks so much for joining us. Today we're going to take a look at what are the steps of giving CPR. Now before we jump into the steps of giving proper CPR, high quality CPR is what we call it, we want to take a look at when do we give it, how do we know that we need to give CPR, and also what's the purpose of it? Why are we actually giving CPR? What do chest compressions do? So the first thing that it's important to take a note of is anytime somebody's unresponsive and they're not breathing, that is a life-threatening emergency. So we're automatically going to phone 911 or the designated emergency number, and we're going to want to begin CPR cycles immediately. Every minute we delay doing something, the person's chance of survival decreases by about 10%, 7 to 10%. So it is really important to jump on and beginning those compressions in terms of CPR cycles as quickly as we can and as soon as we can identify unresponsiveness in the absence of breathing. Second thing to take a note of is what do compressions do? So as we give compressions on someone's chest, they still have remaining bits of oxygen-rich blood in the heart and lungs. Those compressions, when performed on an adult at a high quality level, should be at least 2 inches deep at the rate of 100 to 120 compressions per minute. And what we do with those compressions is we contract the heart, right? And every time we push on the chest and we make a contraction, those remaining bits of oxygen-rich blood that are left in the heart and lung area can circulate the bloodstream and provide oxygen to the vital organs such as the kidney, the liver, and especially the brain. So we do want to make sure that we are jumping on immediately as soon as we can identify those things, because every minute we delay doing something, we're decreasing the person's survival rate by about 7 to 10%. So compressions are really important. Now as we do that, we want to get in proper body position with our shoulders over top of our hands using a two-hand technique, right? Interlocking fingers. Right in the center of the chest across the nipple line is where we'd like to be in terms of aiming point. And we're going to begin compressing at the rate of 100 to 120 compressions per minute, at least 2 inches deep. The cycles of CPR include 30 chest compressions, and then we give 2 rescue breaths if we choose to give breath. Now we have another video coming up on hands-only CPR and the main differences between just doing hands-only versus traditional CPR, which is 30 compressions and 2 breaths. So after we give our 30 compressions, we want to open the airway past neutral, pinch the person's nose for the adult and child, and we want to go a complete seal over their mouth with our mouth, and we want to give what we call a rescue breath or a mouth-to-mouth breath. That breath should be enough to see the chest rise and fall. That is going to demonstrate to us that the air is getting in and we are providing air and oxygen. Granted, it's a small amount of oxygen. A little bit is better than none. So again, we will have another video coming up on hands-only CPR when we might want to do that. But in terms of the main steps of CPR, right? So we took a look at why do we do it, when do we do it, and what does that actually look like. Couple things, we want to make sure that we don't put ourselves in danger, so we want to check the scene, make sure it's safe, and again, check the person for responsiveness. If they're unresponsive and we determine that they're not breathing, then we want to jump into those CPR cycles, which again, 30 chest compressions, giving 2 breaths, go back to compressions, go back to breaths, and we're going to keep flowing through those cycles until a few things happen. Number 1, the person shows visible signs of life, purposeful movement. That's great, right? That's best case scenario. Second is we become too tired to continue. Another is the scene becomes unsafe. Another person can switch on and off with us to help reduce responder fatigue. And lastly, if EMS personnel arrive and take over providing care. Hopefully you found this video useful and valuable in terms of what the main steps of CPR are and what they look like and when do we perform CPR. Thanks, have a good one.